Good morning, and welcome to today's i3 Health and Oncology Data Advisor interview. Today, we're having this interview to share an update to i3 Health's Dedifferentiated Liposarcoma, or DDLPS, task force activity. I'm joined by the two task force co-chairs, Dr. Richard Riedel and Dr. Candace Haddox, who are here today to share some new perspectives on the position statement and podcast, which are available on i3health.com, as well as some insights in honor of Sarcoma Awareness Month in July. Dr. Riedel and Dr. Haddox, thanks so much for coming on today. To start off, would you like to each introduce yourselves?
I'm Candace Haddox. I'm a medical oncologist at Dana-Farber Cancer Institute in Boston, Massachusetts.
And I'm Rich Riedel, a sarcoma medical oncologist at the Duke Cancer Institute in Durham, North Carolina.
Awesome. We'd like to start off with a brief overview of what DDLPS is and why it's so challenging to manage.
So dedifferentiated liposarcoma is one of a subfamily of soft tissue sarcomas, which overall are very rare cancers. Dedifferentiated liposarcoma is actually one of the most common subtypes of soft tissue sarcoma and often coexists with well-differentiated liposarcoma. Both of these are adipocytic or lipomatous tumors, most often arising in the retroperitoneal area or in the extremities. They are characterized by MDM2 and CDK4 amplifications, which has been a hot target for drug development and really getting at treating them based on their biology. I think one of the challenges in treating these diseases is that they're actually, even though they share the common diagnosis of being a liposarcoma, there's a lot of heterogeneity in terms of how patients present, the locations of the disease, the pace of the disease, the aggressiveness. And I think that does make them challenging to treat clinically. And then also, I think that there's a fundamental need to understand more about why they're resistant to specific treatments, including chemotherapy and some of the targeted therapies. So there's just a lot more to understand about them.
Thanks for explaining. So are there any trials investigating new therapies for DDLPS that you're looking forward to seeing results of in the near future?
Definitely, we have a lot of ongoing trials right now that we hope to hear about soon. I think one that's important to mention is STRASS-2. So this is a trial that's investigating chemotherapy in the perioperative setting. So for patients presenting with retroperitoneal liposarcoma that's amenable to surgery. And we still have a lot to understand about whether these patients would benefit from using chemotherapy as part of their initial strategy to hopefully delay or prevent the development of future recurrence or metastasis. So this is an ongoing global trial called STRASS-2 that will probably take several years before we see results from, but certainly one to keep in mind and refer patients to centers that have it open. And then I mentioned the CDK4 and MDM2 amplifications, and there are a lot of trials that are ongoing attempting to target these specific genomic alterations. So one is the Brightline 1 trial, which investigated brigamadlin versus doxorubicin in advanced dedifferentiated liposarcoma. And this study we anticipate having results of soon. In addition, combining cemiplimab, which is a PD-1 inhibitor, with the CDK4 inhibitor palbociclib is also being investigated in dedifferentiated liposarcoma, and hope to hear some results from there as well. I'll kick it over to my colleague, Dr. Riedel, to see what other suggestions he has for trials to look out for.
Yeah. So SARC-041 is a study that's being led by Dr. Mark Dixon and Memorial Sloan Kettering. It's looking at the use of abemaciclib when compared to a placebo in patients with advanced dedifferentiated liposarcoma. As Dr. Haddox mentioned, CDK4 amplification is along with MDM2 amplification is commonly seen in this disorder. And so this is an effort specifically to try to target the CDK4 portion of that. The study has completely accrued and results are eagerly anticipated. So there's a lot of enthusiasm about that trial, and it may actually allow us to add an additional weapon to our armamentarium if the results are positive.
It's very exciting. So in honor of Sarcoma Awareness Month this July, what messages about DDLPS would you like to share to help raise awareness of it?
I'll go ahead and start and then get Dr. Haddox's input. I think, so as you mentioned, July is Sarcoma Awareness Month, and While dedifferentiated liposarcoma is what we're talking about today, it's important to note that we want to recognize all the sarcoma subtypes that our patients are affected with. But certainly for dedifferentiated liposarcoma, it's particularly aggressive. It can be challenging to treat. Again, we would really emphasize the importance of referring patients to centers with expertise, where we will often work as a team to improve outcomes for our patients. And we are happy to partner with our community-based colleagues and share recommendations with our community-based colleagues. But I think it's important that we at least consider seeing these patients as part of as the initial management decisions are being made.
I would also echo that. I think that you raise an important point about the importance of multidisciplinary care. And I think really when it comes down to it, it's the challenges of applying limited data from these smaller trials to individual patients. And that's where having the expertise from a high volume center is important to develop that plan for the patient. I'd also like to highlight that even though this is a rare disease, I think that there is a lot of enthusiasm in developing novel treatments that really target the biology of the disease. So there's a lot of ongoing studies looking at how to target extrachromosomal DNA, and that extends beyond liposarcoma, but of course has a lot of importance for liposarcoma. And then understanding more about the immune microenvironment and chromosomal complexity and maybe more surface targets, since we see this wave of antibody drug conjugates coming in oncology, and understanding whether those may be relevant for dedifferentiated liposarcoma. I think these are all things to pay attention to and to have hope for. Even though it's a rare disease, there is a lot of active research ongoing.
Awesome. And as we wrap up today, why do you encourage those watching this interview to check out the task force position statement and podcast?
It gives a nice overview of the management and some of the things that we're excited to see come out in the future. Like we've mentioned, some of the trials that are anticipated to read out soon. So just gives a nice overview of management and previews some of those future advancements that we hope to see.
And I would just point out that while we emphasize the importance of teamwork for managing patients, there was a team involved in the creation of that particular manuscript. So we had representation from medical oncology and pathology, radiation oncology, and surgery. And so I think it was really a team effort, which correlates nicely with what we do in the clinics themselves when taking care of patients.
Amazing. Well, thanks so much, Dr. Haddox and Dr. Riedel, for coming on today to share these messages. Always great to hear more of your insights. And I encourage everybody watching to check out the task force to hear more as well.